years. This fellow is our IT person, Joe Uhrinek, and he has a degree in pharmacy and has worked in healthcare for all that time, too, long time. And he became the IT person for the checkup center, and we now have all kinds of computer savvy stuff, which is just great. I'll start with what our center is about. The Community Checkup Center is a nonprofit health center providing quality care to Harrisburg's diverse and underserved children and adults. All are welcome, respected, and treated regardless of their ability to pay. CCC strives to partner with other health and nonprofit organizations to support our patients and their neighborhoods. This is a picture of the front of the building. We have actually, our doors are a different color than the rest of Hall Manor. It's located right up the hill from the DMV, if people are interested in where it is. We were founded in 1994 by Head Start mothers who were concerned about the lack of quality health care in their area, and Market Square Presbyterian Church helped them to start the clinic. We're a 501c3. We're within walking distance of 2,500 public housing units with more than 3,500 Medicaid eligible children. 59% speak Spanish and 75% are Hispanic. We provide preventative, chronic, and acute health services to women and children who are uninsured and uninsurable. We provide high quality care. We accept patients regardless of their ability to pay, and individualize the treatment of each patient. We work to deliver services in a holistic approach with healthcare recognized as an important function. These are the people. These are the staff at this point.
Yeah, those are MA's registration and care, actually. So in the top left is our receptionist, Jenny. Johnny Castillo is a medical assistant. Mercedes is our clinic manager and our community health worker. Arlene, to her, our right, is a medical assistant, and on the far right is Karen Still. She is our nurse practitioner for women's health. She's been there 25 years.
Are they all bilingual?
Everybody except Karen.
Yeah.
Everybody there is bilingual except for me and the providers, which is probably should be the other way around. But yeah, everybody. It's now a job requirement.
Arlene has been there for 17 years. The staff, over all the time that this clinic has been in effect, the people tend to stay, the workers.
We actually have the same people for the last 2 years, no turnaround. So everybody there seems alike.
We have access to care for 3 different housing projects in South Harrisburg. We like to have appointments ahead of time, but there are times when people need to just come. It's a place for people to obtain health care if they need to. And it definitely decreases the number of non-emergency room visits. Most of the patients can walk if they need to. And as I said, we accept them whether they can pay or not. We try to avoid language and cultural barriers with the bilingual staff. You're up. This is Mercedes,
Yep.
again at the desk.
Yep, Mercedes, and that's her kids. So we have permission to use the children. That's
Yeah. Where a private sector responds to the need for healthcare reform, specifically for the uninsured and the uninsurable. You can do the statistics.
I'm a stats person.
You're the stats
All
person.
right, so this is actually our 2024 visits. We had 2,200, which is actually still down since COVID. We were over 4,000 before COVID. But the need for social distancing and just the matter of keeping people away, we have to cut our appointments back, things like that. So we're kind of pushing towards more quality visits at this point. 608 were kids, 1221 family planning, 172 are not family practice. We now have providers as adult patients as well. And then the community health worker encounters, and that's actually since April. We just started, so that's probably more like 400 a year. People coming in need help with insurance, transportation, things that have nothing to do with their actual doctor visits. Get a lot of shots, 678 immunizations, 402 well women, and 44% of those patients had no insurance whatsoever.
One thing that is great is that, is that our patients do not refuse immunizations. They are very happy to have their kids immunized. This is Arlene, and she works with Karen in the women's side, and she's the one who's been there for 17 years. And she has a son who's the same age as my granddaughter, so we had all these, connections. Again, we have Hispanic 50%, African American 20, white 21. Do we have any American Indian? Couple? No, we have everybody. I can remember having people from Mexico and Turkey show up. You just never knew. You want to do this? All right. 1 in 3 teens experience sexual or physical abuse or threats from a boyfriend each year. 55% of parents and children under the age of 18 have not talked with their children about domestic violence, dating violence, or sexual assault. On average, a woman will leave an abusive relationship 7 times before she actually leaves. Domestic violence is a crime of power, control, and manipulation. It occurs across all socioeconomic groups and does not discriminate. Currently, and in the past, this checkup center has partnered with the YWCA, who send a representative to work with violence as needed. Here's another group of the girls. Just some statistics about where we're located. A person working 40 hours a week on minimum wage earns $15,080 a year. For a family of 3, the poverty line is $19,500. The rate of those living below the poverty line in Harrisburg is 29%, double the national average. 94.5% of youth in Harrisburg School District live below the poverty level. And almost half of youth aged 18 to 24 do not have a high school diploma. Mental health is the primary cause of homelessness at almost 19%. The most common causes are family breakup and drug use. South Allison Hill has the largest number of single-parent families and TANF beneficiaries, which is what? There's Mercedes. They also have a permanent tree, which I love, and they change it each season. This is the Easter tree. Right now they have a Mother's Day tree with flowers and bows on it. The pediatric services are primarily, they take care of primary health care, preventative, acute, and chronic. Women's is primary gynecological care, but they also have STD and HIV screening for both women and men. Referrals to specialists are made, including dental. We do health education, immunization, screenings. There is translation services if they are non-Hispanic speaking. Domestic violence counseling, which we talked about, and assistance in social determinations of health. And telehealth visits are available thanks to our IT person here. You can do this. You know what they are.
So right now, we have 10 people total. The part-time medical director is Dr. Coyle, he's there 1 day a week. Part-time volunteer pediatrician, we actually have Dr. Hoffman comes 1 day a week, volunteers, which is excellent. 2 cross-trained bilingual medical assistants at Jolly and Owen. 1 part-time GYN nurse practitioner that's Karen, she's there 3 days a week. A full-time community health worker and our clinic manager, she's Mercedes. 2 admin staff, that's me and the billing girl, custodian, and Jenny, her receptionist. And we have a nurse practitioner to start in 3 weeks.
Funding. We have limited insurance payments, and that may change very soon too as the national medical things change. We have Title X programs which come through what?
That's federal.
That's federal.
That's a grant. That's a
A
federal
grant. We apply for grants wherever possible. We take donations, we do fundraisers, and sometimes patients will make contributions. Certainly not enough to cover the whole thing. Charlie,
What's Title 10? I don't know.
what is Title X?
Title X is a grant through the feds. It's actually for family planning services and as women's health,
Okay.
things of that sort.
Yeah, just never heard of it.
Top right-hand corner is me and Linda Hengst, who was our manager for 15 years. When she retired, Joe took over, thankfully. And the bottom is Dr. McAllister, who was there for 20 years as our pediatrician before she retired. Our funding for nonprofits, any nonprofits, is very limited. And the costs of technology keep going up because you have to keep changing and upgrading, which Joe does admirably, keeps track of all that. We get no sustaining state or federal funding. And of course, personnel is the highest cost of everything. I mean, without,
You pay rent?
no, we do not. The buildings are part of Hall Manor housing unit, and the Housing Authority in Harrisburg gave 2 units which were transformed into the exam rooms and other.
We pay $1 a year.
Yeah,
So
except they
hospital.
don't want the dollar
Yeah, they
because
don't-
it's too hard to
Yeah,
keep
we have
track
to pay for it,
of.
that our lease says $1 a year.
So do they maintain it for you?
Yeah, they do. They recently, Joe got them to repaint the whole building and fix a lot of things that were broken. I mean, we had cracks in the walls, the
Wires hanging.
wires hanging
Heat and
down.
electricity they take care of?
We pay no utilities. And the board keeps wanting to, expand the clinic or move it. And And if that were done, it would cost a huge amount of money because we would have to renovate a space and then pay for utilities and maintenance. So we sort of just stay put. Some of the funding challenges is that the funding for nonprofits is very limited. Well, we went through that. But again, personnel is always the highest cost. You can have all the equipment you want, but if you don't have people to use it, you have nothing. You just can't do it. Challenges include lack of space, lack of funding, neighborhood safety. We frequently have police roaming around. Uninsured and uninsurable patients, so you have to make up the cost of those. Other expenses to patients that are covered by the clinic. They now have a room full of diapers and women's health needs. What else?
Like toothbrushes, toothpaste, vitamins. If that's through one of the Title X grants that they send us, all kind of stuff just to hand out. I mean, it's unbelievable the amount of things. That room is so hot.
Yeah, it's
really
amazing. They need to maintain a bilingual and caring staff. And caring is the big word. And that's something that has always been part of this clinic, is caring staff. Maintaining and enhancing the board of directors. That's difficult, and there is a need for new board members. Some of the people that we partner with are the Harrisburg Housing Authority, the Hall Manor Residents Association, Hamilton Health, Pinnacle Health System, Hershey, YWCA, United Way, Beacon Clinic, and CASA. This is
That's Dr. Holly.
This is
That's
Dr.
our
Holly,
volunteer.
our volunteer doctor. Community funders include Highmark Blue Shield, Foundation for Enhancing Community, the United Way, Family Health Council, Stabler, McCormick, and Klein Foundations, and Capital Blue Cross. And I will say that at one time, the Rotary Club decided to make some of the CEOs that belong to that organization available to the community as helpers in whatever needs they had. And we applied for one of those, and we were given Dick Zimmerman. And so we had, he got us involved with Stabler, McCormick, and Klein Foundations, which still give us funds. This church has done remarkable things for the checkup center. And one of the first was to upgrade our phone system when I started, which was 20 years ago. It provides funds from the mission committee. It provides many volunteers over the years on the board and on numerous short-term needs. And they gave me the confidence to take on a failing organization. This was Gwen Gentili, who passed away last year. She was our gynecologist who worked in Kings County Hospital in New York and came to the clinic about once a month to take care of the patients that Karen could not take care of and needed more help than what Karen was trained to do. And we missed Gwen very much. She was a force of nature. She liked to dance. She always, now this picture is odd because she does not have on a plaid flannel shirt. That was her her costume, as it were. And she was 88,
Ooh,
85, 88 when she passed away. She was still working. She also worked at a family planning clinic up beyond State College, and I can't remember what the name of the town was. Anyway, these are some of the people from this church who have helped over time. David Dunkel was the one who got me involved because he knew I was involved in public health work. Harold was our treasurer for a number of years. Marilyn and Charlie helped with computer stuff. Greg Smith would get the kids together for Easter baskets and donation things. Paul Query did some construction stuff inside the clinic. Pete always, because he was in charge of the mission committee for a large part of the time. Teresa, because she always helped me use the equipment in the office when the grants were on paper. I had to make copies to send places. Marion, of course, with D-Chip and helping me get connected to the Presbyterian Apartments Board, and their president, Steve Proctor. When I started doing this, he was my mentor as far as executive things that had to be done and things to look for within the clinic. John Russell was teaching a class on writing grants, and he had his students write one of our first grants and taught me how to do that. Jim Crow was on the board at one point and helped to mentor one of the staff. Jim George came from the medical center and helped us keep connected to them. Chris Gallerin now sorts books at the Hershey Library, and when she comes across especially Spanish-speaking children's books and also other books that they're culling from their collection, we give them to the clinic. And Cindy, of course, was involved in everything. And she got me involved with the Dauphin County Medical Society Alliance, and a woman there, Ann Froelich, came and did readings to the kids, and now still comes and gives books. So, and I'm sure there are people I haven't mentioned who have done things. And our church also collects calendars every year, which we take to the checkup center, and the families take those either as calendars or as pretty pictures. Does not matter.
Gretchen, you haven't included yourself, and you became the volunteer executive director for how many years?
6.
There you go. So
Well, I
she
was
stepped in that role.
executive director, I was president of the board, whatever title they needed on a piece of paper, that's what I was at that time. And I learned to write grants.
I grant writers and I still.
Well, I can give you a sheet that. There's a program through the Y called Women of Excellence, and again, you have to send in an application for this. Louise Kunkel, who some of you, Louise or Mary would know, received it in 2013. She got a Legacy of Honor. Meta McAllister, our pediatrician, in 2011, and I got it in 2016. And it's quite an honor with the number of people in the Harrisburg area who contribute to the lower income community. There's some more of our girls. Our wish list. New board members. A mobile exam room. What Joe would like to do is get a van that could go like to the schools and help give the immunizations, so that we get more kids. Another bilingual medical assistant, financial support always, grant referrals. In other words, if you know of grants available in the health field, he now has grant writers. I'm jealous. Patient referrals also, and collaborations with other organizations. And there's how to reach him and the community checkup center. So, we didn't take much time at all.
That's good.
So, questions? Oh, please. We didn't cover everything, did we? What else would you like to say about the clinic that you now run?
I've been there 11 years. Started like part-time IT, kind of made my way into director. I think by default, it was interim for a year, and then we decided to just take it. It's just one of the, I just kind of hooked on it. I go there every day, and I'm just so used to it. Staff, we get along well.
Staff
love
loves
each
it.
other. Staff love each other, so that's perfect.
Yeah.
No fights and things like that. It's really good. It kind of runs itself, to be honest with you. You know,
Except for all the paperwork.
outside of the paperwork and, pay the bills, make sure the lights are on, things like that. But it kind of runs itself. It really does. Everybody just does their job, and so much is, I can't tell you how grateful I am. Mercedes holds that place together.
Could you elaborate on your relationships with the hospitals and what do you do with acute patients who need additional care?
Yeah. Anytime you do family practice and complex kids, you have referrals to specialists, things like that. Hershey Med has a program, Lion Care, that sees uninsured people. Considering almost half of the people don't have insurance, it's kind of hard to get them into specialists and x-rays and lab work and the extra stuff that goes alongside of the doctor's visit. UPMC gives us $20,000 a year as an indigent care fund, so we can send patients for x-rays, lab work, things that the providers need, and it's just covered under a voucher, which is, can't tell you, especially with women's health, because Karen sometimes needs to order an ultrasound, it's $500. So somebody without insurance, $500 is a lot. So we just send them and they take care of that.
How about mammograms?
Mammograms are actually covered by the Healthy Women program, the PCCP, but we send them to I keep calling them UPMC, because they also participate with the Healthy Women program. So we would refer them. It's the same as when we do an annual PAPS and HPV testing, we get reimbursed through its Healthy Women. So it's breast and cervical cancer early detection program. So it takes care of PAPs, mammograms, and actually if we need to send somebody for an abnormal PAP for further testing, it covers that as well. And that's through UPMC. We send them there. They're also a Healthy Woman provider, and they bill the procedure. So the patients are getting sometimes pretty expensive things taken care of, which is...
Do you have a count of how many people that you serve over time?
Total or over a year?
Not total, or how many people like now are you?
Right now, about 900.
About 900.
900 to 1,000. We're looking, that's gonna go up. hopefully, we have a nurse practitioner starting. When Dr. McAllister retired, we had a big hole, because she was there full-time, and the big shift in her visits were kids, mostly pediatrics. And when she left, we had Dr. Coyle one day a week, who really is an adult medicine provider, but he did some well checks. And Kelly's gonna come in and do well checks. She's gonna actually see everybody. She's a family practice nurse practitioner, so she can do women's health, she can do kids, she can do adults, she can do the whole thing. So I'm hoping to boost that number up a bit, because it was quite higher, because before COVID, we had Dr. McAllister full-time, another pediatrician, and then Karen. So we actually had pretty much 2 providers there every day seeing patients, and hence we had like 4,000 visits a year. Now we have like 5 provider days a week, which is 1 a day. So hopefully with Kelly coming in, take care of some of that, we'll boost our numbers up. But a lot of them are repeat customers, and we have a lot of pediatric adult care people that go to the women's clinic for the GYN. So there's crossover of about 100 people here.
There are also women who were patients of Dr. McAllister's who now bring their children.
And further,
Yeah.
grandchildren.
Yeah.
I mean, unfortunately, we have a lot of young mothers, and so they're bringing grandchildren and things like that. So,
What is your coverage area?
I'm sorry.
What is your coverage area?
You mean,
Like the city or the county?
a big percentage of it, about 65%, is actually South Harrisburg and Harrisburg. But we have people come from Lebanon, York, Juniata County.
Wow.
Those are actually Karen's patients. They just wouldn't go anywhere else, so they travel
Often.
from all over.
Yeah.
Very good.
Do you
Question?
have any community outreach with birth control?
Can't hear you.
Doing birth control programs proactively into the community?
No, not into the community, but when girls reach a certain age, they send them over to Karen to learn about birth control.
Yeah.
He was asking
Oh,
if
yeah.
we had outreach as far as
Yes,
birth
Title 10
control.
is really big, the family planning, Title 10 is really big on like teen prevention, pregnancy prevention. Actually, I just started a program that goes through and teaches them from A to Z, from abstinence to this is all of your options. And Karen will sit there and talk for hours on stuff like that. So, you know, she's very good at counseling and very good at which methods may or may not be good at that.
Pete?
I think your patient care has morphed into the food bank, you know.
What's that? I'm sorry?
Your patient care morphed into the food bank. It's still there, but Maria was helping patients, and that's how
Oh,
we got more involved by.
Food bank.
Yeah, we stopped, but the food bank still is in effect at all manner there. Still.
oh,
running.
it's still going?
Yes.
Oh, good.
Twice
No,
a
that was, did you know Maria? I don't think you were there when Maria
No,
was there.
she left over
She was social worker, whatever, but she started a food bank in the Lutheran, well, first she started it within the clinic, and then we went bigger, and the Lutheran church that is on the next corner was empty, and the, Harrisburg Food Bank would bring Central Penn would bring food there, and she had a list of people who, came regularly, and we doled out food there, so it's good to hear it's still going. She'd be pleased.
So who supplies your supply room with diapers and?
That's through one of the Title 10 programs. It's actually how Mercedes got certified as a community health worker. It's a grant to help with other things other than your medical care. So transportation, food bank, all kinds of stuff. But they actually send that stuff to us for pretty much, we don't pay for it. But it started with diapers and women's hygiene products, and I mean cases of diapers. We had nowhere to put this stuff. And they have been sending it, it's part of a grant, part of a federal grant that we signed up for. We got her certified as well.
So do you have a volunteer that manages that space or collection, or does the staff?
The staff does, because part of that is I mean, Mercedes is big on the community health worker aspect. So if someone is seeing a women's health patient, if Karen has a visit, she can give them whatever. But when we have patients walking in for diapers or walking in for whatever else, Mercedes will sit with them, make sure that they don't have other needs that they're either afraid or don't realize that they have, or afraid to say something about it. And she'll sit and ask them, do you have enough food to eat? Are you worried about this, worried about that? And it's all kind of together. It's helping.
She also monitors it so that these things do not go out the door and be sold to someone else.
Oh, yes, which is another
Which is a
reason why
big
we're
thing
walking.
that has happened over time, including birth control pills. I mean, you know, the girls will go out with a packet of birth control pills, go down to the corner and sell them. We're giving them out free.
The diapers are big, believe it or not.
I bet.
They make a fortune. The diapers are expensive.
Yeah, hi. I volunteer over at Loving, and so we work with the local food banks. And one of the things our personal care closet item works with the diaper bank, and we have diapers on our list. But frequently we'll have people call, like, who maybe have just been registered, just been certified, and they'll place an order with us, which includes diapers, and then they'll say, but we need diapers right now. Well, we don't have them to give them right now. Are you saying that we could tell them they could come, they could walk in to the,
Yeah, when we
Check
first
it out.
started the program, they would, I mean, cases of diapers. People were just walking in, like it's the corner store, and walking out with boxes of diapers. But, and again, we had to kind of nip that in the bud a little bit for our
Yeah.
non-patients.
Sure.
When patients see one of our providers, we collect income data and all of the stuff the government wants, race, ethnicity, would be language,
Right.
what's your income level, all that stuff. And so our patients are one thing, we can just say, you need diapers, that's fine, we can monitor.
Sure.
The people that come in that aren't our patients, again, we'll make them sit with the community health worker. She'll collect all that information, because we have to report it.
Sure.
Even though it's, our patients, it's an easy report because we send them on
Yeah.
visits. But we have to report it, so she's now trying to at least clamp down on the lack of people wanting to go out and sell it.
Yeah.
But yeah, you could send people.
Okay, yeah, it actually is something that just happened this week, and this woman had twins, and she, I don't know what to do, and just
Yeah.
assumed that we could give her diapers, but we don't physically have them
Yeah,
in
I
our
mean,
stockroom.
as long as they understand it's not gonna be walk in, get a box of diapers and leave, they're gonna have to sit and spend a minute,
Mhm.
fill out, give us some,
Okay,
that
that's really good
kind
to
of
know,
stuff.
because it does come up. and it's-
However, one thing we do not ask about their, what status?
Immigration.
Status as to citizenship or anything like that. And none of that information would ever be given out. Anyway, I mean, we take whoever comes in.
yeah, and actually, all of the MAs are very sensitive to that too, because although they're all citizens, they know, and a lot of their relatives are here,
No.
that, a raid could take people out.
Yeah.
So, they're very sensitive to that. As a matter of fact, they're handing out the red cards with your rights as a citizen if ICE shows up, things like that. But we're trying not to target so they show up the clinic either, so.
Right. Another thing that Loving could do, if there are women who need health care, to send them down to the
Sure.
clinic.
Okay, that's great.
But
to know.
as, we said earlier before you got here, they prefer appointments. And up here is how to get in touch, but we don't have a phone number. Just very simple, 717-233-1700. Dial that enough.
Yeah.
But actually, if you hit our website, contact us with email and phone numbers, and you can get a hold of us.
Okay, I think you are on our referral list. I mean, we have all the community agencies, but I really wasn't aware that diapers does come up just as an entity, and so I wasn't aware of that.
That was, the diaper thing started about 8 or 9 months ago. We didn't really have a
Okay.
whole lot of stuff. And the WHS grant started with diapers and women's menstrual products, things of that sort. But man, the list is, there's like 50 different products we can order. It's unbelievable. And so we have a stock room up there, like all kinds of stuff. But yeah, if somebody needs something, send them over, and we'll probably try to solicit their health care as well.
Yeah, and that's wonderful, so, yeah, thank you.
So your patients and clients are basically women and children. What about the men?
For,
Men.
we see men, yeah. Karen will do STD testing on them. She does.
But not whole health.
Not OL.
No, just STD testing.
But Dr. Coyle sees adults now too, so we have patients.
Do you?
Oh, yeah. Well, we have about 150 adult patients. Unfortunately, most of them don't have children.
And that's,
I was gonna say now, because you have so many uninsured and uninsurable, I guess one of my questions is what makes a person uninsurable? Like,
Their immigration status.
okay, they're immigration.
Non-citizen, uninsurable is politically correct for
Okay.
non-citizen.
I was wondering if sometimes, sometimes income might make some people uninsurable only because the cost of the insurance.
And actually, you're right. I mean, you get somebody to a comfortable level with
Right.
income, and they're no longer eligible for medical assistance or some of the other things that's out there, but they can't pay for their own insurance. So yeah,
Yeah, because sometimes it's a matter
they're
of.
considered insurable though.
Okay.
But
Because-
uninsurable, yeah, because
Okay.
when Mercedes will sit down and sign them up for insurance, go out and do medical assistance, but if they don't have a social security number, you can't even start.
And will she help people who don't, like maybe who are of the correct status to get insurance? I don't know how to say it politically right, but some people just don't know how to handle the paperwork.
That girl will do anything
Okay,
for anybody.
that's
Like
where I
I've seen her in
find-
her office for an hour just helping somebody navigate their bill with UPMC. They didn't speak English, she'll call there. And she was on the three-way call with the billing department at UPMC for like an hour. But yeah, she'll do anything for anybody.
Yeah, because I know some people, it's a matter of just not,
I'm sorry?
I said, I know some people, it's a matter of not understanding or not having the ability to understand,
Yeah. Oh, yeah.
how to, because they don't make it easy.
No, and actually, you'd be surprised how many people don't want to give up the information that they don't know how to read or they can't, they don't know how to write or read. People will just try to get around it and not really come out and say it. If they would just come out and say, hey, I can't read, they'd get out of there 20 minutes ago. But yeah, that girl's perfect for the show. She would just do anything for anybody.
You serve such a wide area. How do people find out about you? Who tells them, or what are the pathways?
Believe it or not, word of mouth is is unbelievable. Because when Karen especially, she's been there for so long that she's just so used to it. But she'll sit down with a new patient and say, how did you hear about us? 5 other patients told her to come here. Like she has, it's just unbelievable the following she has. It really is. We went out to a Christmas dinner at a restaurant, and the waitress recognized her because she was like, I know you from somewhere, and then she realized.
Do you have organizations out there that send people to you?
Yes, but not as much as I'd like. It's kind of like, I'm really boosting up the whole collaboration. It's part of our mission statement anyway. But I'm making friends at Beacon Clinic and other nonprofits and other free clinics, things like that. And Beacon Clinic is a free clinic in Harrisburg. I'm not sure if you're aware of them. It's only people without insurance that can go there. But they're sending people back, and we send people back and forth to each other all the time. And actually, the nurse practitioner, Kelly, works there 2 days a week, and now she'll be with us 3. So she's sending patients back and forth to see them. They'll see them for adult care, they may be diabetic, whatever, and she'll send them to Karen to go to the women's care. So yeah, we're working on trying to boost that up a little bit, just because it's kind of, everybody's in the same boat.
That almost has a following question. How many people can you support? You say there's about 900.
I'd like to say infinitely many, hence the mobile van. Because right now, we have two and a half units of hall manor. So we have we have 2 exam rooms, and then Karen's room is upstairs. But I'd like to get another provider and put them in a van and let them go to do well checks at schools, shot immunization clinics, sports physicals. Those are guaranteed appointments. When you drive to the school, they march right out to you.
Yeah.
And that's it, and all of them know they're coming. That's the way, that's a 0 no-show rate right there, guaranteed.
Thank you.
Do you, because of being in Allison Hill, do you find there's people that are timid about coming there because it has a bad reputation?
We've had providers that were supposed to come and interview and just kept driving and didn't even stop. We had one lady she was a nurse practitioner, no, she was gonna be the clinic manager. She was a Marine sergeant or something like that. Her husband was also in the military. Her husband would let her even drive there to interview. Said, you're not welcome. Yeah. But yeah, people were afraid.
But we're actually in South Allison Hill, which is, they're like two sections, one on one side of 83. And
You're on the south side.
yeah, and we're on the left side.
Okay.
We're basically straight up the hill from the DMV. And there's a whole low-income housing, all manner up there. And that's where it started, and we are still there. They thought it would last a year or 2. 30 years later, it's still there. So obviously there's a need. So are you gonna do your Star Wars pitch?
No, Pam's happy that she's not watching it now. She's got a couple hours break. It's gonna be a marathon at the house.
Yeah, because the 4th be with you.
Yeah, of course.
I know it's my birthday and I'll get about 10 of them today.
You
Bill?
had listed Hamilton Health Center as one of your partners. Can you describe your relationship with them?
Actually, the community health worker thing kind of is doing that, because they have, FQHC is required to have people, if you were to come into an FQHC and see them and say, I don't have insurance, part of the requirement is that they sit and try to get you insurance and collect income pay stubs. They have to have hard data on how much money you make, things like that. And we've been meeting with the community health workers there and just trying to get ideas. And unfortunately, for a community health worker to be successful, she needs a Rolodex of numbers of where do you send people for this, or somebody comes in with this issue, where can I send them, and that'll help along the way. And we've been kind of communicating back and forth with the best ways to handle it. Because again, since they're federally qualified, they've been doing this since they've been open. And it's part of the whole federal requirement for patients to be seen there as uninsured. So we're kind of we see them at meetings, we're taking and giving. Mercedes is scheduled to go and shadow one of them to see like what their actual workflow is. Plus, I worked there for 10 years and I know a lot of people, so a lot of times I just pick up the phone and say, "Can you help me with something?" So,
We also support, the dairy supports a clinic at 13th and Dairy. Is that at the Presley Church?
That was
Is it
the
in the
Lutheran,
basement?
no, the Lutheran Church, 13th Dairy. What was the name of that, Sarah?
It's the Christ Lutheran Church.
Christ, yeah, it was
Yeah,
Christ Lutheran Church.
It's Vanessa Garcia is the nurse who runs it.
I'm not positive, but I think Holly volunteers there.
Could be.
She goes to another clinic and
Yeah.
fairly certain it's a true
I'm assuming that it's geography that, because they provide the same
Well, and
stuff.
they're on the other side of 83 also.
Right.
And there's no shortage of patients in
Yeah.
We could have 3 more clinics and they don't visit.
The advantage of you is that many of your patients can walk
Right.
to where you are.
That's a big.
Many don't have
These
the
are
ability
drives.
to have a car.
And that was part of the reason that it was put where it was, because there was already a community of need right there. Yeah,
I was also just gonna share that the clinic at 13th and Dairy is more adult, and they don't do it's a nurse-run clinic, so there are no physicians there that I know unless they start coming in. So it's a slightly different mission, but I'm happy to get you connected with Vanessa if you guys want to see how you guys can collaborate more. They're doing a lot. They see a lot of folks who are uninsurable as well. And I think it would be a great connection.
Yeah, we're not fighting for patients. For sure. It's definitely.
Become- but COVID kind of skewed a lot of things.
Right. So I'm just curious, is there more that Dairy could do for you as far as collecting things or a wish list or volunteers? I'm just curious on behalf of the mission committee, I'm asking that question.
You couldn't hear you. We have a
Oh,
fan
I'm
going back
asking,
here.
I'm
I can
asking
barely hear
if
you.
there's more that Dairy could be doing for you to support you. I mean, we've supported Gretchen for years and we do support you, I think, still financially, correct?
Yes. Mhm.
Board members.
Yeah, board members.
Tell you. I mean, I've been there for a minute and we are just in need because some of the people on the board are just aging out since we've been on the board 10 years. They're not allowed, I think our charter says no more.
Like
than your
free,
board.
yeah.
You know, we have people there, we have people that are gonna be leaving. But lately, the problem with our board is like lack of participation. We've had board meetings, we don't have a quorum, so we just can't have the meeting, can't get things approved. And just to show up for an hour on a virtual thing, if you're gonna do it, you know. But if I just get some enthusiastic bodies to be a board member, that would be marvelous.
What's the commitment to the board?
Pardon me?
What is the commitment to the board?
What is it?
The
Yeah, what's
commitment.
the commitment? We have a fan back here.
I realize.
Yeah.
I couldn't tell you the exact, but I talked to my president, he said if anybody's interested, give him my information and I'll talk to him further. And if you'd like, I can give you Chris's information. It's not really of anything but show up to the meetings from what I can tell. Participate.
And no, I mean, you've heard what the goals are and how the place functions. So it's more how to keep it going. And another thing we've found over the years, which to me is really strange, board members have not always gone to see the clinic, which blows my mind. I mean, if I'm on a board or something, I want to see it. And there are people who have never gone to see the actual structure.
Half of the board members have not stepped foot in.
I mean, and how small, I mean, the whole entire clinic, 2 floors, is probably the size of this room. And yet, what can be done within it is pretty remarkable.
But I would assume that your board has a structure that they have a nominating committee, so therefore, they should have some kind of board expectations in writing.
Yes, I know there are.
So
I could probably produce it.
I think that, if you're looking for a board member, I think it would be really appropriate to have another connection with a board member from Derry Presbyterian Church. Again, I think you would really like that support, but of course, we can't nominate ourselves. But if you would want to send us the information, we could see if there are some individuals that might be interested in becoming a board member and would be willing to meet with your board.
Yeah, because we just need fresh ideas. I think we're operating on some old ideas that need to be freshened up.
Well, plus it'd be interesting to see a current list of your board members. Anyway, we can.
Anybody have a pen? I'll get this gentleman's name.
I'm just gonna email that.
Oh, okay, great.
Oh, there you
And your
go.
name is, I'm sorry.
Dave Giampetro.
Oh, you were one of my doctors. You did an injection in my back.
Oh, I hope it worked.
Yeah, it did. But you know, you were behind a mask and I was face down, so, yes,
All right.
I know the name.
Yep, send me an email. When I get there Monday, I'll shoot you back like the whole.
That would be
I
nice.
know I have it. I just, to be honest with you.
I'm not making any promises.
No, that's fine. That's fine. I mean, right now, if you can do an hour meeting a month,
It depends what time it is,
it's usually on a Thursday morning.
so that'll be a problem.
And you'd have a medical person. To me, I mean, I was the only medical person on the board for many years, and the things that the rest of the board didn't know about how a clinic functions is just, they don't know the back room. In other words, they just know you go in, you see the doctor, but they don't know all that has to go on to make that happen.
Running a clinic is a little different than running other businesses. And some of the ideas that came out of that board meeting, just like,
We're not a hospital.
Well, I think we need to have a board list and the board expectations, board members' expectations
Yeah.
to be emailed. And if you'll email them to me on behalf of the commission committee, I can also reach out to other individuals.
cool. Yep, I'll get that. I know what I have is an old signed copy from somebody that's on the board now that I can just, I'll put it in Word, that it be, and send it to you.
Anything else?
Any other questions? Well, we thank you for being here and giving the presentation, and thank you very much.